Yes. You know the old saying, you are what you eat. Well, do you really know what it is that you're eating when you put something in your mouth?
Well, we thought we would ask Dr. Nigel Brayer from the Living Tree Center for Healing. Thank you so much for coming back. I can't wait to talk to you about this.
Everyone was a little nervous earlier today. So.
You know, we eat something that isn't necessarily good for our bodies. How long does it take to work itself through and get the bad stuff out of our bodies?
Well, Andrew, there's a couple things. If it's just fat, then it's just fat, and we're concerned with the accumulation on our body and heart disease. But as Michael had mentioned about French fries, when we start getting into the toxic foods, the chemical-ridden foods, hydrogenated fats, which is the standard grease that we use to make French fries, the average is 59 days. And so you think, yes, that French fries.
That's a long time.
I'm in trouble.
Days.
Yeah, that's, again, a hydrogenated fat is like a plastic, it's not found in nature, and it's going to affect your body for a very extended period of time. So what happens is it accumulates, and so the French fries just made in olive oil or whatnot, that's better. But when we start getting the French fries from the local, drive-through, there's a lot worse.
So you like my option of bacon?
I like your option. That's a good option. Fats aren't inherently bad. They all have to be in balance. It's the type of fats, hydrogenated fats, and then the chemicals, which we can talk about a little more, is they build up, and that's where cancers come. That's where learning behavior disorders in children, etc.
Well, what about cleansings? That's kind of the rate right now. Sure. A lot of people want to do that. Does that really work? Does it get it out quicker than 59 days, or should we just drink a lot of water?
Okay. Well, drinking a lot of water is just a general. We all want to do that anyway. Cleansing is a useful tool. However, if you don't stop putting it in, it's kind of like dumping more toxin in and deciding to clean it up once in a while. It doesn't really have a big effect. So what I encourage people to do before they cleanse is start making choices of less packaged food. It's really actually been found that the pesticides in food are less abundant than all the toxins found in plastics and plastic bottles stored in animal fat. And so those things actually build up, and over a lifetime they accumulate, and that's where so many cancers and diseases show up.
And we'll get more to that part in a minute, but first we're going to go through, you put together a list of some diseases that are associated with children and adults. First for children, we'll take a look at this. Birth defects, ADD, ADHD, asthma, allergies, and obesity. These are children's diseases that are linked to food poisons. What do you feel like is the best diet to feed your children, especially now that we live in a world where everything needs to be about convenience because we're so busy?
Sure. Well, we always have to find a balance. I'm a parent too, so you have to find, well, what works, what doesn't. The big things is, if I had to talk to parents, which I do every day, is get rid of the plastics as much as you can. Start using glass. Don't feed your child in a baby bottle with plastic, because when it's leaching into the milk, and anything with fat in it is going to leach the toxins more, and they build up, and a child's brain is developing, their endocrine system is developing, and there's a huge number of diseases that are associated with that.
Only when you put something hot in the plastic, or even when you have something cold in the plastic?
In general. So they say the more bulk, the better. The more packaging, the worse it is, like a cheese stick. And again, I'm at risk of this too, as I give my kids cheese sticks. However, there's so much plastic for such a small amount of food that in time those leach in, especially since cheese has fat. Fat molecules and chemical molecules combine together very easily and quickly.
All right, well, you have a list for adults as well. We're going to go over those. Cancer, neurodiseases, MS, Parkinson's, autoimmune diseases, chronic pain and fatigue, and sleep disorders.
Is it possible to reverse the effects of eating toxic foods?
It is. The body is a great detoxer, and so it's like a filter. It has a great capability to filter unless there's just too much junk. So the key is to reduce the junk. The quickest is to organic food, and then try to get away from the plastics. And then second of all is push in the water, and then doing cleansing once you've actually eliminated it.
You know, Mike, the list of diseases that Michael just read for adults, I mean, those are some very severe, serious diseases. How much time does it take for that to build up? I mean, are we talking about, so if someone says, oh God, I've had a cheese stick every day for the last 10 years. I mean, is there really a lot of poison coming from that plastic?
Well, part of us we can always justify, so we're all going to do it based upon what we like. Most of these diseases build up over a very long period of time. And so especially in the fat tissue, we know obese people have a much higher risk of these diseases than non-obese, because remember, fat is the storage depot. And so again, it goes back to the overall fitness, the water, the exercise, sweating to keep those things pushing out. But obesity is the big key.
Well, we've been talking about what you're doing to poison your body. Let's talk about tips to decrease this poison. Reduce and or avoid, that seems like the simplest one. Cleanse and support the organs. Now, are there different kinds of cleanses for different kinds of people?
Not particularly, except the more toxic the person, the more catastrophic the cleanse will be. That's why it has to be a trend. Doing the best you can, starting to eliminate. If the average person did a 21-day cleanse, they're going to feel horrible because they're dumping all this toxicity into their body. So more or less, you want to be monitored by a physician of some sort who's experienced with it, and you want to do it slowly because there's no rush. Now, if you have a degenerative disorder and you're suffering the expense of it, you have to be more quick. But for somebody who's not experiencing symptoms yet, it can be a little bit slower.
And real quick before we go, is there a way to measure how toxic your body is?
The best possible way is, how do you feel most of the time? How do you sleep? What's your energy level? Those things that we used to notice when we were in our 20s and early 30s of energy-wise, those are indicators of just in general how you're feeling.
So get the poison out of your system.
Get the poison out.
There you go. And if you want to do that, you can call Dr. Nigel Brayer at the Living Tree Center for Healing in North Royalton. Just go to livingtreecenterforhealing.com for more information.